Fever, pathophysiology, symptoms, and treatment. You suddenly notice your body temperature is rising. You are feeling lethargic and fatigued and feel the need to rest. You are most likely experiencing hyperthermia, commonly known as fever or temperature. Many of you might already know this, but do you actually know what's happening with your body? In many infections and illnesses, your body responds with a fever. But why? Knowing why your body reacts the way it does when you get a fever is very important to understand when to take it seriously. Some of the commonest fevers can get really complicated if not treated timely. In this video, we are going to answer all your whys about fever. But wait, before we begin, please press the subscribe button and hit the bell icon to stay updated with many other videos like this. Let's move in the video. This is how and why you get a fever. How do you know you have a fever? Our normal body temperature is in the range of 98 to 100 degrees Fahrenheit, 36 to 37 degrees Celsius. In case of any illness or infection, the temperature rises above this range, and we call it fever or, in medical terms, pyrexia. Usually, the fever is a manifestation of your body fighting an infectious agent. What to do when you first feel a rise in body temperature? Your first instinct should be to fetch a thermometer and get the exact value. The reading here you have tells you whether it is low grade or high grade. What is a low grade fever? When your temperature is higher than normal, but lower than 100.4 degrees Fahrenheit, it's called a low-grade fever. Low-grade fevers may not be as serious as the high-grade, and their common cause may include a common cold or a minor ear infection. It is also common among many individuals to have a low grade after a shot or vaccine. But if a low-grade fever persists for long, your doctor might have something bad to tell you. Children might get a low-grade fever prior to the eruption of cuspids or molars. On the other hand, high-grade fevers are always a sign of complex infections. How do you get a fever? It is very likely that if you have watched the video to this point, you are very curious to know about how you get a fever. Several regulators in your body function to keep it working in the optimum state. If, for any reason, this balanced state of the body is disturbed due to pathology in any organ or organ system, these regulators are triggered. One such regulator is a thermostat located in the hypothalamus, a part of the brain. When there is a fluctuation in the body temperature, hypothalamus is triggered. This most commonly happens when pathogens like viruses, bacteria, fungi, or other parasites enter your body. When your immune cells attack the pathogens, they start producing pyrogens. Some of the microbes also produce pyrogens. These pyrogens travel via the blood and reach the hypothalamus. They chemically stimulate the hypothalamus to, in turn, stimulate thermoregulatory organs of the body to retain more heat. Thus, you experience a rise in temperature and fever. The elevated temperature makes it less favorable for the pathogens to grow and divide in the living tissue. That is why fever is often referred to as a blessing in disguise. Though mostly fever is not always caused by an infectious agent. Other causes may include sunburns, cancer, hormonal imbalances like hyperthyroidism, a side effect of medications, high alcohol, and inflammatory disorders like rheumatoid arthritis. Do you think you know a lot about fever? We highly doubt it. What are the different types of fever? Fevers can be classified on the basis of their causal factors or the pattern of occurrence. On the basis of pattern occurrence, there can be persistent fever that lasts between 10 and 14 days or longer. A constant fever or continuous fever may appear to change by 1 degree within a 24-hour period but does not touch the baseline. Another type is chronic fever that recurs for several months or years and lasts between 3 and 4 days at a time. In remittent fever, the temperature does not touch the baseline, normal, but the daily variation is around 3 degrees Fahrenheit. Most infections present remittent fever. In intermittent fever, the temperature rises to fever levels and remains high for several hours, and is then followed by a fever-free period. Thus, we can say it fluctuates between the baseline and fever level over the course of a single day. The next to know are the associated symptoms with fever. The fever may present itself along with many other associated symptoms. The combined picture may denote a specific infection, and so, understanding the various signs that follow fever may actually help in early diagnosis of the actual disease. The most common associated symptoms with fever include chills and shivering, which are most common in malaria. Another very common symptom is a headache that is most likely to accompany in case of sinus, ear, nose, or more severe infections like meningitis. Some other common signs that may be due to the persistent fever itself are general body weakness, irritability, loss of appetite, dehydration, muscle aches, or sweating. How to manage low-grade fevers at home. It is common to experience a slight rise in body temperature after a hectic day at work or after the first day of gym. In these cases, more than regular exertion is the predominant cause, and the fever goes away on its own or by rest. The best way to treat a fever in these cases is to drink a lot of water to prevent dehydration. Take paracetamol in appropriate dosage. Take a bath in lukewarm water and rest. You should also avoid coffee, alcohol, or too much tea. Now we come to the most important part of this video, that is, when to seek medical assistance. Is the fever too high, or is it a persistent fever? You should always know when to give up home remedies and consult a doctor, because if the fever is not resolving on its own, delaying the treatment any further can be dangerous. Specifically, these are some indications that tell it is time to see the doctor. The fever persists despite 3 days of home treatment. The temperature is above 40 degrees Celsius. You are feeling hot but not sweating. In addition to these, you are vomiting, having frequent loose stools, experiencing rapid heart rate, and other unusual symptoms. A too severe headache may also indicate something serious. What treatment options do you have? Your physician is most likely to take your temperature and understand the various associated symptoms to design a differential diagnosis, which will be then followed by a definitive diagnosis through lab tests and reports. If there is an infection, which in most cases is, you are prescribed antibiotics and other combination drugs. With the right medication, the fever takes around 3 to 5 and sometimes 7 days to resolve. Bottom line, in any illness, it is important to know when to consult a physician. One should never try too hard to resolve the fever on his own. In most cases, the fever alone cannot cause death. I hope you liked this video. Don't hesitate to comment your queries or a piece of additional information. Also, like and share the video before leaving. Subscribe to the channel for more videos like this.